We are back here at Atlantic Health Systems, Atlantic Sports Health, with Dr. Neil Shah, musculoskeletal radiologist, and really exciting to learn more about exactly your role, and can you diagnose and can you treat, and I believe you can.
That's right, yeah. So we work very closely with the sports medicine team here, the physicians, sports medicine, orthopedic surgery, etc. And as a team, we can help diagnose and also treat. Musculoskeletal radiologists, we spend an additional time in training doing a fellowship where we learn all the advanced technologies, MRI, ultrasound, CT, X-ray. And so we use that to diagnose, but then also to treat. So patients may come in for a ultrasound-guided joint injection. So say they're in pain, we can come in and use the imaging to see in real time where the needle's going, where the joint is, and in a very time-efficient manner and safe manner provide the steroid or whatever treatment is requested into the joint. In addition, when we're trying to do an MRI of very small structures, such as the labrum, we would use contrast in the joint. So we'll do an ultrasound-guided injection into the joint, and then the patient will have an MRI after. So we'll put contrast, which is mostly just salt water and a little bit of magnetic dye into the joint, and then you can see where the contrast goes. It helps distend the joint capsule so that you can have that fluid in there and see everything in the joint in much greater detail. We also can do diagnostic injections. So say someone has pain that may or may not be related to the hip, it might be related to the back. We can inject into, say, the hip, a finger joint, knee joint, wherever someone's trying to question, and just put in lidocaine, Novocaine, the same thing as the dentist, just to see if we turn off that pain receptor for a little bit of time, is that the source of the patient's symptoms? Maybe it is, maybe it isn't. If it is, then they know the next line of treatment.
That's really impressive. I mean, your history and your experience, you continue to gain this expertise, right, to help diagnose. And when you really think about it, you're looking at these images all day, every day, and the more you look at, the more you're becoming familiar with different limitations. So that makes a lot of sense to be able to go to someone like yourself, not only go through that procedure of getting evaluated with the technology, but then having your input to help the doc, the team make decisions. And I feel that's what's really great about Atlantic Health. You guys have such a cohesive team, and how you work so closely together. And as you continue to build those relationships, it's really enhances patient care.
Yeah, I agree completely. It's a great experience.
That's awesome. Thank you so much again for joining us. So there you have it. Some great information on understanding imaging technology, who administers it, and how it's evaluated, and how we treat, or how you guys treat here at Atlantic Health Systems.